Becky and Brian Cheetah are pretty familiar with the halls of Children's Hospital in St. Paul, Minnesota. They've got twin sons in the NICU. While that's been hard on them, they weren't surprised.
I had a history of preterm labor and with my daughter, and so we knew that every week after 20 weeks was a good week. So we were trying to make it to 32. We made it to 25.
We attend deliveries. We then move babies from the delivery room to this environment and provide whatever kind of help they need. Some babies only need it for a real short time. Some babies need help for quite a long time as they adjust to living in the world.
It was kind of unreal at first, where, a couple hours earlier we were in the delivery room and you could see that whole operation taking place, and then you come in here and it's like they're not your kids. It's like it's a movie picture or something going on.
What's going on is medicine and technology mixing to help premature infants make the transition from living in the womb to living in the world.
The isolette helps keep the baby warm. This is for jaundice. This is an old treatment. They've been doing this since the 50s, but we still need it today. And all of these IV pumps are for different medications and for different solutions. Sometimes they're for nutritional support, sometimes they're for maintenance of blood pressure and support of the heart. Sometimes it's antibiotic medications.
Mike and Jake Cheetah are gradually gaining weight and getting over hurdles to better health. But to give you an idea of how small the boys were when they were born, their heads were about the size of a tennis ball.
And it was like holding a feather. I mean, they were very small. My husband put his wedding ring on Michael's arm, and it went all the way up to his shoulder. And now you can't even fit it over his hand, and that's 10 weeks later. So it's pretty interesting. Okay.
Though the Cheetah family's experience in the NICU has been good, it hasn't been easy.
It's been longer than I thought it would be. I mean, we figured it would be 3 months, but it seems like there's 30 hours on the day sometimes. So I think I learned a lot of patience through the whole process, and certainly have a lot of faith in the situation here, the system here, the care, the nursing, the doctors.
The Cheetahs are used to spending part of every day in the hospital and have grown accustomed to what life is like there. Many hospitals allow parents full access to the NICU. But other visitors should first check with the hospital about its visitation policy, who can visit and when. Next, make sure whoever's visiting is healthy. That means no colds, no sniffles, and no active chickenpox or recent exposure to chickenpox. And the American Academy of Pediatrics recommends you leave the latex balloons at home.
Balloons are fun. Kids love to have balloons around, but we use the Mylar or something else because there is an increasing prevalence of latex allergy among healthcare professionals and some children, especially children with chronic illnesses who have lots of exposure to latex.
And latex balloons may present a choking hazard as well. Pediatricians recommend you bring some items from home, including toys and photos, to personalize your baby's space and help the whole family feel more comfortable. Jake and Mike have a photo of their 2-year-old sister Katie in their crib. Mom and Dad say their daughter Katie has helped them keep everything in perspective.
With Katie running around the house, you see the end product. With these guys, they're a work in progress, so having her around it was nice to see that end result.
While the Cheetahs spend so much time in the hospital, they try to keep things as normal as possible at home. Their advice to other families is don't be afraid to ask questions. See if the hospital has a family resource center like this one for information and relaxation. And above all, don't forget your own health.
Don't feel like you need to be here 24 hours a day, because the nurses are wonderful. They're there when you can't be. And you'd be able to give more to your babies and to your family if you take care of yourself.